Assalamu alaikum. Today we'll be examining the language aspect of the mental status examination. Of course, we'll start with the typical YP mnemonic. So I will wash my hands, introduce myself. My name is Momin Halabi. I'm a fourth year student. I was asked to examine your language. Would that be okay with you?
Yes.
Okay. Privacy is assured. I will confirm the patient's demographic. And then we'll start, inshallah. See, comprehension, repetition, naming, reading, and writing. First, we'll start with the fluency. It's important that we start with the fluency because it will affect the ones after it. It's really important to ask the examiner for a picture because we're trying to assess the fluency. For example, I have a picture here. I can give it to the patient. I need you, please, Wafi, to describe what you are seeing.
Okay. There is a big mom, maybe their grandmother, and there are many children playing around. Some of them are over the tree, and some of them with their grandmother, some of them playing here.
Yes, okay. Thank you, Wafi. His fluency is perfect, mashallah. Also, there's an aspect that we can assess the fluency. It's better to ask for the picture, and it's really crucial to ask for a picture in the examination. But during the YP, when I asked for his demographics and asked him for permission, etc., I can also see the fluency. So I know it's kind of fine, but to be really sure about it, I have to ask for a picture from the tutor or the examiner, and then ask the patient to describe it. And in this patient, his fluency is, mashallah, perfect. Now we're going to assess the second aspect of the language assessment, which is the comprehension. So I will give the patient or the subject a complex command. I'll see whether he follows it correctly and does it correctly or not. So in this situation, Mr. Wafi, I need you to touch the back of your left knee with your right thumb.
Okay.
Okay, perfect. There is a crucial point to mention here is try not to mimic the movement. So when I say Wafi, try to touch the back of your left knee with your right thumb. I don't do like this because he can see it and he can cheat, and it wouldn't be an accurate way to assess the comprehension. Now we'll assess the third aspect of the language assessment, which is the repetition. And we can do that by giving the patient a short sentence to repeat multiple times. So it's important to know whether the patient is speaks Arabic or speaks English. For example, if we're in an OSCE examination, it's usually an English-speaking subject. So I'll give him a sentence like, Wafi, can you repeat after me? No ifs, ands, or buts.
No ifs, ands, or buts.
Again.
No ifs, ands, or buts. No ifs, ands, or buts.
Okay, perfect. So we can see that he can repeat the words normally. If the patient speaks Arabic, I can tell him to say, for example, يمديك تقول 44 again 99 perfect. His repetition is perfect, mashallah. The fourth aspect that we want to assess in language assessment is the naming. So in order to do that, we ask the patient to name an object. For example, I'll take here this object. I should not name because he will try to cheat. What is this object called, Wafi?
A bottle of water.
Okay. What is this part called?
Bottle cap.
Okay. And what is this part called?
A paper of...
Okay, paper. Yeah, perfect. Okay. The fifth aspect that we're going to assess in the language is reading. So I'll give the patient a piece of paper or something to read. For example, هنا في العباد عندي حديث نبوي. تفضل شيخ.
قال رسول الله صلى الله عليه وسلم كلمتان خفيفتان على اللسان ثقيلتان في الميزان حبيبتان إلى الرحمن سبحان الله وبحمده سبحان الله العظيم.
Okay. شكرا واف. The last aspect of the language assessment that we will assess, inshallah, is the writing. So I will give the patient a piece of paper and a pen. Can you please write the university name that you currently a student in.
Okay.
Okay, that's enough. Okay, thank you. Wafi, mashallah, really pretty handwriting.
Thank you.
After finishing the language examination, the reason we examined those 6 aspects is if the patient's aphasic, we can classify his aphasia, whether it's Broca, Wernicke, conductive, global, transcortical, etc., based whether he's comprehensive but not, but he's not repeating the words, or he's repeating but he's not fluent, and etc. So it's really important to examine all those aspects to classify the patient's aphasia. It's not really asked frequently to say which type of aphasia the patient is having, but it's really important to note. At the end, I will wash my hands, thank the patient, thank you, Wafi, and I'll summarize the results to the examiner.